I would like to introduce to you all Dr. Josh Stilley. He is an emergency medicine and EMS physician. He started as in EMS as an EMT firefighter in 2001 on a volunteer service. He attended undergrad at Iowa State University, medical school at the University of Missouri, and emergency medicine residency at the University of Iowa. He is board certified in emergency medicine and subspecialty board certified in EMS. He's currently the medical director for multiple area agencies, including University Ambulance and the Children's Transport Team. He's active at the local, state, and national level and has a strong interest in emergency medicine and EMS education. And with that, I'm going to turn it over to Dr. Stilley.
All right. Thank you for having me on. I've got the Q&A open, so I will try to pay a little attention to that as we go. I'm Josh Stilley here at the University of Missouri in Columbia. So thank you for having me on today. This is talking about the Mendon AMTRAK crash and specifically lessons for the rural response system. I've given this talk and had some presentations and interactions with, I think, quite a few members that are probably on, and I appreciate you inviting me into this group. So with that, there we go. No conflicts of interest to disclose today. Objectives, we're going to know the events of the Mendon AMTRAK derailment, apply the principles of mass casualty response to the rural EMS setting, understand the unique benefits and limitations of an MCI in a rural location, understand the role of the rural EMS medical director in a mass casualty event, and adopt lessons learned back to your own agency for implementation. That's really the point. Like, we're going to have some information. I really hope that I garner a lot of questions and help you look at your own systems for improvement and preparation, because it's not if, but when a disaster happens. This is the Southwest Chief. It is an Amtrak train that travels from LA to Chicago. Has 2 locomotives and 8 passenger cars. This day there were about 270 passengers and 12 crew. The speed limit is 90 miles an hour through the middle of Missouri for this train. And apparently Amtrak trains actually obey the speed limit, so they're going 89 miles per hour. So up to, but not over the limit, unlike automobiles. So where did this happen at? It happened in the middle of Missouri. So I think most of you are familiar with Missouri. And let me pull on my laser pointer. All right, so we've got Kansas City on the west side of the state, St. Louis on the east side. And then this is Sheridan County in the north central part of Missouri. I'm here in Columbia, which is right about halfway between St. Louis and Kansas City. It's about an hour and a half to the edge of each of the cities from Columbia, 2 hours into the center. Up to Sheridan County actually takes about 45 minutes minimum to hit the county border from the edge of Columbia. So it's a little bit of a drive and more once we start getting up there that we'll see. So as we zoom in on the county itself is kind of an awkward layout. Most of the population is down here along Highway 24. So Salisbury, Keatsville, and Brunswick are the bigger towns in the county. Salisbury is actually where our ambulance headquarters is located. Again, this is where most of the population is for the county. Mendon is up in the south or northwest part of the county. So it is a pretty good haul to get up there. On the north side, Marceline, Brookfield are a little bit bigger towns just north of Sheridan County. All right, let's zoom in. I worked on these videos like hours. I think I spent more time on the videos getting those to work in Mendon. The town itself, not a major metropolis. So this is not a very big town. It's a pretty small town. What's going to come into play is the Northwestern School. That is the school in Mendon. It's not a very big school, but is a school building. It's really the biggest building in town. The crash actually happened just south, so a couple miles southwest of town along the track. So railroad tracks here. The crash happened at this crossing right here. So as we zoom into the crossing, a couple of things to point out. So it's pretty open. However, the issue is it's up a big hill. So looking at the perspective here, it's a pretty big hill to go up to get to the tracks. That comes into play because it was a dump truck that was involved in the crash that the train hit. And trucks had gotten used to continuing on through this intersection because it was really hard, fully loaded, to come to a complete stop, look both directions, and continue on. Trains run through here pretty regularly, but apparently at some point trucks had gotten used to just looking quick and then continuing on. Okay. For the incident itself, it happened at that crossing. When it occurred, come on. There we go. So June 27th, 2022. So a couple years ago now, 12:42 in the afternoon, at that intersection, train hit the dump truck. All of the locomotives and rail cars derailed. So every single train car derailed, and 7 of the 8 cars rolled onto their sides. When it hit the truck, this is a pretty good evidence of that impact. Usually we see dump truck wins most collisions. In this case, dump truck took a pretty significant hit. It's pretty much just ripped apart. Driver, unfortunately, sustained fatal injuries and died within a few minutes of the crash itself. This also gives a pretty good viewpoint of our landing zone relative to the crash. This part of Missouri, lots of open field. So anytime you're going to have an MCI, I really recommend having it next to a nice open field with a nice LZ. So this bean field here, we could land quite a few helicopters at once. The roads approaching, as you can see, are not very big coming to the site. In the train, as you can see, a rollover in a train is very different than a rollover in a car. So we're all pretty used to responding to car crashes and seeing those victims. And even airplanes, they're made for turbulence, for an event. Trains really aren't made for events. So the shelving for luggage is all open, so it comes out pretty quick. The seats are all open. There's no restraint devices. So even though it's not a big fall, there is a lot of things moving. So people falling and hitting objects, as well as people falling and hitting people. So a fair number of injuries occurred inside the train itself. The 911 call was interesting in this part, or at this time. The dispatch system is not terribly robust. So our dispatch center has 2 phone lines that come into it, 2 dispatchers working at a time. And in rural Missouri, 911 call, difficult to determine location. You would not expect somebody traveling on the train through the middle of nowhere to know exactly where they are. And we do not have E911 in this area. So it took a little to figure out exactly where the crash happened. Once our own dispatch center in Sheridan County gets at capacity for phone calls, it rolls over to Lynn County, the county next door to the north. And you can imagine lots of phone calls happening all at once. So difficult to coordinate between the 2 dispatch centers as well. The Emergency Operations Center ended up getting set up in Lynn County because they have a little bit bigger facility and was closer to the crash. However, the crash happened in Sheridan County, which also led to some of the confusion. For dispatching units, I'm not sure what it's like in your areas, but in this part, most of the fire departments are actually all on one radio channel, but usually there's not more than one event happening at a time. So it's not too hard to track which unit is en route. In Sheridan County, each individual fire department, volunteer fire department, has its own engine 1, engine 2, and so forth. So when all of them started going en route at the same time with our mass dispatch mutual aid response, it became very difficult for our dispatch center to actually track which unit was going when. And usually our dispatch center does a good job of that, of tracking units en route. However, in this case, there are so many units going en route so fast with the phone lines being nonstop jam-packed that they really had a hard time keeping up. Well, what does a firefighter do if they can't reach dispatch on the radio? They call, which was not a helpful thing to have happen during this event because of all of the phone calls already coming in. So I think it's important that we have some backup systems in place for tracking. That doesn't always have to be a communicator job, tracking what is going on. So whether that's an automated system, which we don't have in Sheridan County, or just individual units tracking their own times for later accounting. That's a very appropriate way to do it, or some other communication within the agency. A good rule of thumb, in a mass casualty incident, dispatch is not your incident command system. So we need to make sure we have our incident command separate from our dispatch center, assuming our dispatch center is going to get overwhelmed. We see a lot of events. I try to read a lot of after action reports. We see a lot of events where communication centers are still tried to be used as the bridge for an incident command, and it doesn't work very well, especially between different types of services like law enforcement and fire. We see miscommunication happen. We've had that in Columbia. We've had it on other events. So I think understanding that your dispatch center cannot be entirety of your communications plan and your incident command plan in a mass casualty incident. So units did get on scene. They did get dispatched, and everybody pretty much went to the right spot. However, again, the communication of knowing where to go to the crossing. So the street is actually called Porch Prairie Crossing, or Porch Prairie, in a town south. In that area of the crash, it's Highway 113 or County Road 113. Different units got different locations dispatched to them, so they're told where to go. So Porch Prairie Crossing meant nothing to anybody not from that exact part of the county. So there was a little bit of confusion for where was the exact location. So it's really important. I know it happens in Missouri. I still call stuff by what it used to be named before it was a hole in the ground. Like, oh, we have an old hospital building. It was called Ellis Fischel, so we call it Old Ellis. The building's been torn down. It's not there. I really can't reference for anybody not from town. It's important we don't do that same thing in our 911 systems when giving directions. As you can see, in Missouri, it gets hot, or as you know, in Missouri in the summer, it gets hot pretty quick. Everybody's heard the phrase cat on a hot tin roof. Well, these are all tin, metal, shiny on their sides. The metal got pretty hot pretty quick. So trying to do patient care, get people up and off the trains as quickly as possible was a little bit difficult. Bystanders were trying to do it, worked much better once we had ladders to get people off. First on-scene units took really almost 30 minutes for the first ambulance to get up there, and some of our other units to get up there. Just took a while to get 911 location or the emergency location identified, and then appropriate units dispatched out and then onto the scene. So like we showed before, the location of the crash and the location of our ambulance quarters are quite a distance away. So it took a little bit of time to get on scene. Once on scene, the first arriving ambulance took incident command, quickly supplanted by an arriving fire officer. And then EMS, the EMS unit on scene became EMS incident command. They did a wonderful job of triaging patients. And one of the things in this event, like a lot of other events, triage is the process of assigning severity. It does not mean it's applying a tag. Those are kind of separate things. And in this case, I would dare anybody to find any triage tag used in any of the pictures. We really didn't use them. However, we'll talk about it here in a little bit. Patients went to the right spot. So patients got appropriately sent to where they needed to go. So we actually did a really good job of identifying sick and injured, getting them to the right location. On the back end, tracking what happened, identifying when things happen, documentation, that was hard on the back end, but I'm really proud of the effort that was given on the front end to identify where patients needed to go early. So it took a while to clear the train cars. Some of the patients got transported by ambulance direct to the hospital. Some patients got flown from the scene. So we flew 9 patients directly from the scene to the hospital, and only 2 from our casualty collection point flew to the hospital. So that's a really good assessment that happened on scene to get people out to the right spot from scene in the first place. Okay. All right, mutual aid. This was a big mutual aid response. In Missouri, we have EMS regions and mutual aid regions. So this region, I'm going to back up a little bit. Our EMS regional coordinators for this region started activating other regions to send strike teams, and differentiating a little bit from mutual aid. Mutual aid being the agencies right around, from strike teams being from a little bit broader area for the response. Pretty quickly, the mutual aid coordinators were contacted and started requesting strike teams from different regions outside of this exact region. In total, we had 28 ambulance services, 17 aircraft, 19 fire departments, and 13 law enforcement agencies by our, on the ambulance side, accounting of folks that responded. So pretty significant number of people responded out for mutual aid, which is fantastic. So that's some mutual aid, some of our regional strike teams in that response. Probably one of the greatest decisions that happened is this CCP, casualty collection point. The idea, again, it's hot outside in Missouri. We have a lot of people, and we're out in the middle of the field. How are we best going to assess people, monitor them until we can get transport, and then take care of people's basic needs while we're awaiting that, or especially for those that don't need transport? So 201 people were taken by bus from the crash site to the casualty collection point, which is fantastic. So it got people inside, in air conditioning, access to bathrooms, access just to running water, so we're not inducing heat illness in the middle of a hot summer day in Missouri, which would be a significant risk for people if we're going to just sit them outside and let them exert, or not be in contact with anybody for a while. So the casualty collection point very early in the response was identified as a need and opened up and made available. And we'll talk about that in a little bit. From here, 18 patients went to the University of Missouri in Columbia, 2 to Kansas City, 35 to Moberly Regional Medical Center, 22 to Samaritan and Macon, 29 to Boone and Columbia, and then Pershing Memorial and Brookfield also got some, but I don't have that number. And a lot of these were by bus from the casualty collection point to the receiving hospitals. Each bus had a paramedic on it, so they were medically supervised during the transport, but it was a way to take especially the lesser injured to local hospitals, not trauma patients, but lesser injured to these local hospitals in order to facilitate care and not overwhelm the trauma centers. By our distribution, 18 to the University of Missouri, 2 to Kansas City. Really, one of the things to think about when we do have an MCI event like this, once a patient's in a helicopter, the time it takes to go to a trauma center local versus a trauma center in the next city over, especially kind of being a little bit to the west, we probably actually should have sent a few more patients to Kansas City than we did to Columbia, just to spread out that load, knowing that Columbia University of Missouri is going to get some of the downstream patients that end up in the other hospitals, which we did appropriately. Great question. Where did the buses come from? So the buses were school buses from the school district and from school districts around. So they were able to quickly get buses from the district, because some of the responders, actually first responders, were also bus drivers, and then bus drivers know other bus drivers. So pretty quickly they said, hey, go get a bus. We're going to need buses for the train crash. So wasn't, from my understanding, a highly official, well-organized, written request sort of system for getting buses. People just went and got buses. So it was fantastic. And it happened fairly quickly and early on in the event. All right. Recovery took a little while. So after, it took about 2 hours on scene to get all of the patients off. I think 2.5 hours, which is a phenomenally fast time from the time of the crash to all patients were gone. The longest patient on scene was one that actually required some extrication. So the rest of the patients got off relatively quickly. For 270 people, middle of nowhere, to get off scene within 2.5 hours is absolutely phenomenal. And having that casualty collection point for a place to go was helpful. Okay. I think it's really important to debrief. We did several debrief events following the crash. So we did an agency debrief just to look at what did we as our own agency encounter, and what do we do? We also did a regional and a system debrief. So this brought in more partners so we could have open discussion and talk about it. Extrication challenges, great question. The problem with trains are big, heavy, thick metal. And one of the patients was actually trapped in a window underneath the train. With extremity sticking out. So it took a little bit of time to get that extrication done and get them out. One of the challenges we ran into, we have multiple trains over, we have a lot of broken windows. We know we had at least some people semi-trapped underneath the train. One question that came up is, do we have more people trapped under the train that we just have not found yet? So that was part of the recovery to understand, do we have more people? Question of how was patient tracking handled? Great question. Poorly. This was something we did not do very well during the event. Like I said, the triage tags were not used very much. So it was written notes, written paper, and then a lot of work on the back end. Eric McKenzie, the administrator for the ambulance district at the time, spent weeks trying to track down where all of the patients went. So there was a lot of effort put on the back end. We'll talk about that some more here in a bit. So debrief questions I like to have: what happened? And I think that's a really important thing for a lot of responders on a scene. And that can be in my ER dealing just with a cardiac arrest, single case. That could be on a scene of a sick patient. That could be a small MCI. That could be a large MCI. I find a lot of the anxiety that people have following an event is because they just don't know what happened. If they could fill in those gaps and understand and get that continuity in the timeline, that really helps take away some of the fear and the anxiety, as well as just reinforcing the actions that people did do. We can say, hey, that was a good job. You did a really good job there. I know it was stressful. I know it was tough, but just reinforcing that they did a good job can really help decompress people and help them recover. I think debrief, another way to phrase it for a lot of our responders, is grieve. They have to grieve through a significant event. They have to process the negative emotion and feeling that they feel from the event in order to recover from it. So I think one of the most important parts of a debriefing is just helping make sure that people understand what happened. Tracking was done poorly, and the reunification of families with an issue too. Yes. Fortunately, we did have a fairly limited number of places for patients to go, especially really injured patients. The hospitals did a very good job on the back end trying to figure out who people were and then contacting family from the hospital side for reunification. So I know there were a couple of people that took a while to track down. One of the interesting things that happened, there was a Boy Scout troop on the train returning from Philmont in New Mexico. And so we had quite a few children, and they were supervised by the scout team, but quite a few kids that we had to worry about that did not have adult parents with them. So they got pretty well taken care of. Reunification center, the same as CCP. That's really difficult because in this area, we have people on a train traveling through a random area. It's very different than like a school bus from a local district, because there you could say, oh, our reunification is going to be here, and parents can come and pick up their kids. Here, reunification is difficult. Almost nobody was actually from this area. So reunification was just trying to get people in contact. Other questions I like for debrief: what did we do or prepare for well? What did we not do or not prepare for well? What gaps do we see in our plan? How can that be incorporated into our plan? How can that be drilled? And then my favorite application question: how can we incorporate this into regular operations? I think there's no such thing as disaster operations. Whatever we do under normal circumstances, that's going to be our muscle memory. That's going to be our reflex. If we want somebody to do something under stress, we have to make sure that's part of their normal activity most of the time. Establishing command. Fire EMS, we established command because we're really used to doing that. We're really used to working in an incident command system. It actually worked pretty well, all things considered. We were used to doing that. We were used to identifying sick, not sick. We're used to doing those kinds of things. So, but we're not used to using triage tags. So we didn't use them. We didn't pull them out. We're not used to doing a lot of the other things that we're used to saying, oh, this is a disaster operation. So the more we separate it, the more we have the ability to confuse it. Yep. What 3 words? And then other applications for identification would have been very helpful this day as well. Yep. So successes that we had. Triage was an absolute success. Again, it's not because we tagged everybody and it worked well, but because we were able to successfully identify where patients should go. Patient care went very well. Very little of my follow-up from this event was individual patient care issues. The fundamentals of care: good first aid, bleeding control, hemorrhage control, basic management is a very important part of our patient care. And doing those well is what made this a success. Casualty collection point was an absolute success, being able to get patients off scene quickly to somewhere where they can get taken care of in a controlled environment, access to electricity, a little bit better cell coverage for calling family. Air resources was also another success. We don't have a lot of air resources, but one of the things that happened fairly quickly into the event was the second dispatch center that was contacted for air decided to take over air operation dispatch responsibility, relieve that from our communications center. So it offloaded some workload, and then it also did a really good job of coordinating the air resources. And that's a really key thing to have happen. We want to make sure air resources are coordinated. We don't want to have conflict in the air. We want to get the right number of aircraft on scene. After landing, the first aircraft that landed, actually, the pilot took over LZ control. His clinical crew took care of the last patient to leave the scene, so they were on scene a long time. So that pilot was able to take that role, release firefighters to go back to doing other tasks and activities instead of LZ control, and then be able to coordinate air resources. Pilots are really good at talking with pilots, so able to give briefing, landing instructions, and LZ control, and that worked out very well. Question, how much time for operational periods were local agencies in command? When was the scene turned over the railroad? So after that last patient was off scene, after about 2.5 hours into the incident, wrap up was done pretty quick after we made sure that all of the patients were taken care of, all of the stuff was off, all of the cars were cleared, let me rephrase that, and then soon thereafter turned over to the railroad. I don't know the exact time, but it was not too long of a delay. Allowed for one of the questions that brings up for operational periods in a disaster, how many patients are going to, or how many time sets of care providers are we going to need to relieve people currently on scene? Fortunately, in this, we only had to have one operational period, so we didn't have to cycle people in and out. How many deaths in the crash? There were 4 deaths total in the crash. So not a lot of fatalities, but a lot of injuries. We did not have issue with more capacity for this, but yeah, definitely can be. Was a railroad staff helpful? Yeah, railroad jumped in, was very helpful. One of the issues that we had was that there was not a great manifest with trains. The manifest and control of who's on board is not quite as clear as it is for a flight. So we did not actually have a specific number of people right away, and took actually a little while to figure out exactly how many people were on the train. Not until after we had cleared everybody. So that was a little bit difficult. The staff were great. There was just some confusion. So unique benefits of rural EMS. So we talked about this. Volunteer firefighters are bus drivers. So they heard the page. They knew I'm going to be most effective if I go get a bus. Playing into the railroad. One of the local firefighters in the area is also the railroad radio man in the area, so in charge of the radio system. So pretty quickly able to get the communication with the rail, and they monitor trains pretty closely. So able to, that was helpful in finding the location. School contact is well known. I'm not sure who exactly called the superintendent, but people knew who it was, and he quickly opened it up, because people in rural areas are very empowered to act. They're not waiting for bureaucracy. They're not waiting for things to be told to do. And then volunteers were an asset. Will the railroad make any changes as a result of these learnings? Well, the first, that crossing was closed. It had been requested to have control at that crossing for a while. They ended up closing that crossing just because of the risk with that hill and uncontrolled no stop sign. So volunteer response is something that needs some consideration. So there's several different types of volunteers. There's lay responders, so people, or lay persons just around bystanders, just show up. Lay responders, people who have medical training, who come to help out, but are not part of our normal emergency response system. Are non-requested responders, so people who may work for a volunteer fire department, so in the system, but in part of the response, they may come even if they're not requested. And then non-first responder deployment, so that may be like Red Cross and things. Utilization, first aid prior to EMS arrival. So a lot of bystander first aid was done. In fact, the Boy Scouts that I mentioned, there were actually a couple of emergency physicians on the train. There were quite a few firefighters on the train. So it was actually, oh, my light's turned off because I've been sitting still too long. That's funny. So there were actually quite a few response resources on the train. So it was a very well staffed train for first response event. So they provided really good first aid during that event. Sometimes, though, even after first responders start to arrive, I think it's really helpful to utilize our bystanders on scene, especially medical. Continue doing good first aid. Good Samaritan law will cover acts that are done. And that is a force multiplier for movement with people on scene. I've not always really liked the triage category of everybody who hears my voice stand up and move out of the way. I need those people. I don't want them to go away. I want them, if you can hear my voice, drag everybody you see over to the triage tent. I need people to move. I need that help. On scene, I think it's really helpful to get that patient movement and some of that bystander care. And then non-medical, we use bystanders in a non-medical capacity. Radios channels were all jammed, so they used them, some bystanders and lay responders as a runner for communication, for equipment. Certainly, in any Midwest event, there must be food. So we had quite a few community members show up with food. We had restaurant and other services, grocery stores show up with food as well. So that was really helpful. And then traffic control, we had some bystanders, some lay responders, some townspeople doing traffic control to try to meter in and out of some of the areas. Thank you for the comment, Kareem. That's very helpful. Yeah. AMTRAK, I never dealt directly with AMTRAK personnel, but I think we had good interactions when they were requested. So authority to act for volunteers, Good Samaritan law. Declaration of disaster can go a long way to help say, this is what I need to have happen for the best survival. And then a problem though, how do you identify people? So is somebody wearing t-shirt and jeans somebody that just walked up to the scene? Were they involved in the crash? Is it a volunteer firefighter coming from work? It's really hard to know who somebody is if we don't have some sort of identification. So that can be some sort of vest, that can be ID, that can be branded shirts. I would strongly recommend for anybody that has a regional response system, whether you might go out to a scene, whether you might happen across a scene and are there as a bystander, or for your agencies, I really would encourage some form of identification to be carried in a personal vehicle if there's a chance that that vehicle, you would use that to respond to a scene. Just because it's really helpful to on scene identify who should be there, who should not. And there was a lot of people involved in the scene. A lot of people walked up, a lot of people were on the trains. It's really hard to know who is who in any of these types of events. All right, and then concerns with volunteers, command and control. How do you get them to do what you need them to do? Unrestricted movement, people were coming in and out. Large volumes of volunteers, so we had a lot of people showing up to help. And then how do you keep them safe? How do you keep them organized? How do you try to keep bad actors from entering your scene? I think those are considerations you need to have with any sort of movement. And then on coordination, people very quickly figured out, oh, there's an event, we should go help, whether that's word of mouth, phone calls, text groups, Facebook, other apps. I think it's important to have some sort of communication mechanism so you as a county or an area can help say, we need volunteers, or there's an event, stay away, we have plenty of help. And trying to get some security, that would have been a helpful thing for some of our law enforcement partners. Law enforcement is great in the area, and they're very useful or very used to responding and helping out with medical and car crashes and stuff. In this event, there was a lot to do. We probably needed our law enforcement to be more on the security law enforcement side on scene, make sure our train cars were secure, make sure people weren't entering the scene that didn't need to be there, rather than trying to help with the response. Although that's a really hard thing to ask somebody to do. All right, unique challenges of rolling mess. No computers in dispatch, multiple names for the same location, limited units in county. It takes a while to get places. Limited ingress and egress. Self-dispatching, people saying, oh, there's a neat event, I'm going to go find out what's going on. And then POV response, people were responding in their personal vehicles. And this was the street to get up to the crash site. It's actually pretty good. I've been on many scenes where we would not even have this much area to get in and out. So the fact people pulled off to the side to leave that path open in the middle was actually pretty good. But you could be really hard. If you try to get a string of ambulances through here, it's not going to happen. If you try to move any volume of traffic, it's just not going to happen. Okay. Challenges for any response. Again, coming back to that mutual aid versus regional strike teams versus state response. I think we probably could have done a little better job of coordinating our mutual aid response of our dispatch center, contacting each of the counties surrounding Sheridan County and requesting resources right off the bat. Separate from that is the strike team. There were some counties that were pretty closely located that probably should have been a mutual aid request immediately that got put into the stack for strike team response. It wasn't bad. I don't think we really delayed anything too bad, but I think it's an opportunity for improvement to make sure that each one of our dispatch centers, when we hit the bell for major event, we need everybody we can get, that we know how to make the call or otherwise communicate with our dispatch centers in the area. Okay. It's really hard to know when you do get dispatched, where do people respond to? Having pre-designated sites. Oh, if you have a strike team going from this county or from this area to this area, we're always going to respond to this location. This is just our staging location by default. That would have been really helpful to have some default staging locations, or even just in the plan, this is the one spot to go to. I know even on my response, I got told a couple of different times to go to different places. So it would have been helpful to have a little bit more clarity for some of our other responding agencies. And then when I've responded, almost every mutual aid or strike team response I've been on, I've been told to go to different places as I'm traveling. I think it's best identify one spot, put a staging officer there, get people nearby, and then send them to where you need to go from nearby. And that may be the location we respond to, maybe scene, maybe a casualty collection point, staging location, or a hospital. Maybe, I'm going to need resources to do that second transfer out of the hospital. Communication is difficult, which radio channel to be on, and they were pretty overwhelmed. Very quickly, radio channels got overwhelmed. Triage tags are tough. In Missouri, we're currently working on getting an electronic system that may help streamline that for incident command and patient tracking. That's one of the downfalls of triage tags. They're not active. They don't do anything. They're all passive. We get them after or for one patient. We need systems to be able to manage this. And then unified command. Again, I said we did really well at incident command with fire and EMS. Law enforcement tended to be fairly separate. It's really important when we have an event of this scale that we have one unified command and everybody working together. We don't have one law enforcement event separate from our fire EMS rescue event. Those are the same event. We need to coordinate that well. And then scene security, we actually had people getting back into train cars. So cars would get cleared, we X them out, and then soon find people going in to get their stuff. And so had to get re-cleared. So that took some effort. People had to get cleared, or cars had to get cleared multiple times, and random people just walking onto the scene. This is really neat. I don't get to see this every day. Let's go see what's going on. So trying to make sure that we have good scene security. Absolutely not possible early in an event, but should be a relative priority as the event continues. One of the most interesting parts to me of this whole day, media coverage. I had a phone call from a New York Times reporter on my personal cell phone walking into the casualty collection point. I had just arrived on scene. I already had a New York Times reporter calling me. I'll be blunt. I don't think the state can find my phone number this fast, but they were able to track it down. So I think you have to expect you're going to get media encounters. They may be a little bit pushy. However, media on scene was great. So Kansas City had a news station, had a news crew come out. They were very professional, asked us where they could set up shots, make sure that they didn't interfere with anybody. So I actually had really good interactions with the media on scene. The only time I made any news or camera was here. That's it. I was very excited. I try very hard to stay off camera in events like this. So I was very happy with it. Okay. One of the things to take advantage of is the recognition after the event. My crews did an amazing job. So I was very glad we had AMTRAK did a wonderful job of celebrating them. State did a wonderful job of celebrating the responders. I think that goes a long ways to just show appreciation, part of that recovery, part of that grieving process, and part of just showing appreciation for what everybody that responded did that day, because it was a huge effort to get this done. So I was really appreciative of that. For me personally, I learned a lot of lessons from this event. I think the medical director has a lot of roles in an event like this. Some of that is as an EMS physician. So I, as a physician on scene, can be a pretty good on-care clinician. That may be triage, that may be taking care of individual or several of the sickest on scene. I did a little bit of clearing of non-injured patients. So patients that had little bumps and bruises, do I need to get an x-ray today? No, I think you're good to get home, wait till tomorrow, take care of other stuff, get x-rays later if it still hurts. One of the most interesting things that I did not expect to do was actually prescription ordering. We have a bunch of people that are traveling. Now they don't have access to their stuff. We had a lot of people with daily medications that now could not get their daily medications. We don't want to create a secondary event because of not being able to get medications. First, we had a couple of volunteer nurses from a local clinic trying to go around and get information. But they were wondering, how are we actually going to facilitate these prescriptions? Eventually, I had a call from a local pharmacist. He said, I'm willing to help get medications. I just need a physician to authorize. I was like, well, dang, I'm a physician. I can authorize. This is a disaster. But I said, all right, medication refills, 30 days, no refills, no narcotics, no controlled substances. And I gave them my information. And that helped offload that. So we could make sure we didn't have any downstream effects from people not getting medications they needed. We had some non-emergency staff that were taking care of that, and coordination with the local pharmacist. So I had no expectation that that would be one of the more impactful things I did that day, but it was kind of an interesting part to my day. So EMS physician, being a physician on scene. Second is system oversight, and that is guiding the care of others, so managing who is going where. And I did a lot of that of trying to make sure we had the right resources on scene, managing some of the flow, and then strategic, talking about backfilling. All right, we've pulled every ambulance out of neighboring counties. How do we make sure some of these some of these areas are covered? So some of our strike team response may not be best served on scene. It may be served backfilling. Talking about future staffing, are we going to turn over crews? And then coordinating with other agencies and medical directors. And then hospital liaison. I am part of the hospital system. I am part of the EMS system. I spent a lot of time on the phone, text and phone calls with my ER medical director, my trauma system medical director. It was actually the most phone calls and text messages I've ever had in a single day by a wide margin. So making sure your phone's charged up before any disaster event. Okay. I had a few other lessons. So contact. The contact for me was actually delayed. My agency, I was fairly new for this agency. I expected to get a phone call anytime we had any sort of major events. I try to be very clear. It's in my standard protocol policy book that I get contacted. However, they just didn't think of it early on. So I think this is something that needs to be a very clear and normal part of your disaster plan, probably from the dispatch center. So asking clinicians on scene to do something can be difficult, but this should be part of our dispatch algorithm. So now we're trying to incorporate that into our dispatch algorithms. When we have a major event, I should get notified right away. I need to make sure that they have my phone number, that they will call me, and we'll automate that. So nobody has to do anything. As soon as it's triggered as a major event, I get tagged and notified. Doesn't always mean I'll be able to respond to those or that I need to respond, but as a medical director, I should have an understanding when we do have an event like this. My first notification was actually my wife, who works in our department in the research side, sent me a text of, "Did you hear about a train crash?" And I was like, "No." And there was one apparently in California the same day. And I was like, well, this looks pretty minor. I don't think this is what she's talking about. And then pretty soon thereafter, I started getting some contact. Also important to know for the medical director, how are you going to get somewhere? So are you going to take your personal vehicle? If so, do you have identification? Do you have some basic PPE? And do you have any medical equipment? I actually left my house, went into Columbia, only about 15 minutes away to our agency headquarters, to get a response vehicle and get some medical equipment. But that was probably 15 minutes that probably would have been better served going towards the scene. Not to mention then that's another 15 minutes back the other direction. So quite a delay for me that I would have been better spent responding to the event in the first place rather than trying to get into town to get some equipment. So now I keep a little medical equipment that I would need, not an ambulance worth, but some medical equipment that I would need. Thought about it later. Air would have been an appropriate thing as well. The scene is about an hour and a half from Columbia in my house. I probably would have been very appropriate to request a helicopter to get up to the scene in a little bit more appropriate amount of time, which I didn't think of then, thought of after. But we already had helicopters going in that direction. It would not have been a big challenge for them to land, pick me up somewhere, and take me up. Okay. Question was the scope of your responsibilities for notification for the county, for the region. So I, as the medical director, do not have that responsibility to notify the county, the region. Our agency has contacts with our regional system. For those agencies to notify me with major events, I do expect that with the county, and I'd like to make that a pretty standardized process for our regions as well. If we're activating strike teams, regional medical directors, or state medical director, and local medical directors should be part of that notification tree. Whether or not they need to jump in, but part of that notification tree. Equipment, it's good to have the right equipment. So phone and a charger is really important for the medical director to have. It's a busy day. Having the right credentials is important. I have a radio, so 24/7 I have a radio, but making sure you have the right channels for it, personal protective equipment, and some medical equipment. And then again, it took a while for me to respond, and there was also some delay because my agency, my home agency at the University of Missouri, saw our response, including me, as part of the mutual aid package. However, for me, I'm also the medical director for Sheridan County, where the event happened. I'm not responding for mutual aid. I'm responding as part of the event response. That's one of the fun parts of wearing multiple different hats, but I am the medical director for Sheridan County where it happened. This is not a remote distant event. This was my event. So a little bit different viewpoint depending on the agency. All right. So, and to be clear, my involvement, I did not make it to scene. I made it to the casualty collection point. So I did some care at the casualty collection point, although again, a lot of my intervention was calls, text messages, coordination and stuff on the way up, and then some more of the minor care and the clearance once I got up to the casualty collection point. So I would have liked to have been able to get up sooner, but that's part of the notification and part of that response that we talked about. All right, a few stilleisms. Apparently I say things a lot of times, so things I say a lot. There's no such thing as disaster operations. People will want to do or will do what they're used to. If you want it to work in a disaster, you need to make it part of your regular regular system. Dispatch is not incident command. If you expect all of the communication to go through dispatch, then that's not going to work very well. They will absolutely get overwhelmed. Not their fault. And that happens in major urban centers. That happens in small rural areas. You can't have dispatch as part of your incident command. BLS wins emergency medicine and EMS. It was not any big major medical interventions that won the day. It was the tried and true stop the bleed type care, good basic first aid. I call it the fundamentals, the good fundamentals of care. Plans should be flexible. Adherence to plans should not. You shouldn't have a plan that you never listen to, you never do. That's not helpful. But we need a plan that can adapt to the situation in front of us. And that's important for people to know the plan. If you're interested, through this is our EMS Echo. This is for state of Missouri, but anyone's welcome to come. So we do monthly case reviews, second Wednesday of the month from 11 to 12. So feel free to jump in if you would like. This is a picture of the Boy Scout troop that was on the train coming back from Philmont. So they'd had some first aid training, but they got a lot of a first aid experience this day. I got to actually go up to Wisconsin and meet several of them. This is Mason with the scraggly hair. They really did a really good job of jumping in this day to provide care, a lot of first aid. So what other questions do folks have? Oh, more echo. Perfect. Okay. Am I related to Dr. David Stilling Des Moines? Unfortunately, yes. Yes, that's my dad. My dad is an EMS physician. I got brainwashed. I've been around fire and EMS my whole life. So yeah. I know David Stilley quite well. All right. How did the on-scene command and the team at the CCP coordinate with the hospitals that received the patients? Wonderful question. So that was from the CCP had some command local at the CCP calling the hospitals just to let them know what they were going to get. Kind of two separate commands for the on the scene and then at the CCP. So people are kind of passed off once they got there. On scene command was really focused on that rescue recovery, and then the CCP more focused on that patient movement. Probably a lot of opportunities there for coordination with the patient movement, but kind of a little bit difficult, but a notification to the hospitals that they were going to get patients. A lot of the hospitals in the area saw that there was or knew there was an event and upstaff. So clinics closed, they manned the ER, they got ready. So a lot of the rural hospitals really took it on to be part of it that day and participate well, which was fantastic. Another thing I say is like hospitals don't get to opt out of a disaster. So even if you're not a trauma center, major events like this, everybody gets to play. Okay. All right, next one, were the passengers able to recover any of their belongings? That I'm not sure on. I don't know. I would assume at some point they were able to get their things. That was one of the issues we ran into early with people trying to go back early to get their stuff. I'm not sure at what time they were able to go or how much they were able to get. That's not a question I can answer. All right. Thank you. Yeah, the response was phenomenal. That's why it's important to have systems in place and be ready for it. I don't think you can ever be truly ready for an event like this, just because it is such a shock to the system. Interestingly, they have had train crashes in Sheridan County before, but never a passenger train. So when the first tones went off for a train crash, they're like, oh, somebody hit a car or two people on the train. So it was kind of a shock to their system once they realized what kind of an event it was. How long after the crash did the first patient arrive at the hospital? Great question. I don't know the exact time. The first helicopters on scene don't come from too far away, so probably within. So first ambulance is on scene 30 minutes, and then pretty quickly thereafter started getting resources, and then back down to the trauma center, an hour and a half by ground, about a 40-minute flight. So probably hour and a half after the event, people started getting to the hospitals. Somewhere around there. That's not a for sure time though, so sorry about that. All right, you guys are very welcome. Any other questions? Go ahead and end the show.
Yeah. I was going to say last chance for questions here. Yeah. Thank you. Thank you so much, Dr. Stilley, for this. There's there's a ton of questions that I even had asked or written down that people either beat me to or you covered already with it and things like that. I was curious about one thing.
Yeah.
Is you showed one picture, you had an overhead picture where you saw everything staged in the cornfield and things like that. July in Missouri, cornfields are full. Did did the farmer come out and harvest that area to get to clear a spot for folks on that or anything?
Yeah.
Um, I'm kind of wondering that because like you mentioned, people come out of the woodwork and do all sorts of things. I know here in Nebraska, if we have a field fire, the next thing you know, there's 3 discs running through. Yep, that picture right there.
Yeah. So
I was curious if that whole corner ended up getting harvested. It looks like they ran a strip too, as
I'm
well.
not, yeah, I'm not sure if this was the with AMTRAK doing that, if this was the farmer or what was done to prep that point. This was during the recovery phase later on. This was not right away after the event. So I don't know how that opening was made. The nice part was the one of the fields was a bean field. So June bean field still pretty low, so pretty safe to
So
land
yeah.
on. Cornfields would have been a little tall. It wasn't a particularly wet year, so the corn wasn't too high yet in June.
Okay. Looks like someone I could, and I
Yeah,
will say I did open up the chat for folks. Some folks have figured that out.
yeah,
Looks like Carrie Ann from or Korean, I'm probably gonna say it wrong. I apologize. From Amtrak says the farmer came out, cleared the area. And I think Dale put in the questions, and he's probably right that there's probably both actually of rail repair staging area
yeah, yeah,
for both
yeah.
of those things.
Yeah,
So
that's in the recovery. I don't think it was a part of the our initial response and all though. So um, yeah. Yeah, I don't.
perfect.
It would have probably been helpful in the response to have a little bit more of that area cleared, but not necessary. And I don't.
Hmm.
That definitely wasn't the day of the event. So
Awesome. Well, we'll like any last minute questions or anything that folks can think of. I see there is one type of ICS that got used. Was it
oh,
area command, unified command?
probably the right classification of that would be area command. So at the train site, we had one set of incident command working there, and then separated out. I don't remember if that was a true area command under our formal ICS, or I think it operated more of an independent command there. The hard part with the CCP, there's just a lot of people, a lot of volunteers showed up. We had the passengers from the train. We had lay responders and our volunteer responders there. So part of it was just how many people were there. Really had no idea who was whom. So command was kind of difficult there to know exactly what needed to happen. In the gym at the school is where they set up kind of the treatment assessment site and then farm people out from there. But it was there were a lot of people. It was fairly not chaotic, excuse me, not necessarily chaotic or uncontrolled. It wasn't like it was wild and crazy, but it was probably not as coordinated as it could have been. But I think it actually went pretty well.
And I know you mentioned that the EOC actually ended up getting opened up in an adjacent county.
Correct.
Was it still that county's EM running that EOC over there, or was it the other county's emergency manager that ended up running it? I know.
So the
Yeah.
Sheridan County Emergency Manager was on vacation that day.
Okay.
I can't remember where she was at, but was out of town, but quickly jumped on phone and electronically to help with the management. The neighboring county has a better EOC space, but that is one of the times that did get difficult because the main communications and the EOC were very separate.
Mhm.
So a lesson learned was to try to get the primary dispatch center, and most dispatch centers EOC are linked up, whether that's physically or electronically or just used to working with each other. While the neighboring county's EOC was closer to the event, there was that benefit. It did kind of split that a little bit and almost move a lot of the operations to the neighboring county, which did get a little bit difficult at times for coordination. So um, yeah, I was not in the EOC, so I didn't participate in that directly, but from my understanding, it did make it a little bit difficult for some of the coordination on the back end.
Sure, sure, sure. Okay. Well, we have like officially 1 minute left here, so I appreciate everybody coming and lots of great questions on this one. I appreciate Dr. Stilley with this presentation, super informative and just a different perspective to what was an interesting day for everyone, I'm sure,
It was quite a
when
day.
it
It was quite
happened.
a day to be. I had just gotten off a night shift, so it was quite a day for coming off a night shift.
All right. Fantastic. Like I put in the chat there, we'll make sure